Welcome to another episode of Underscored, a podcast brought to you by Young Voices. I'm your host, Stephen Kent, spokesperson and public relations manager for Young Voices. And I'm really excited today because we're debuting something new in the world of Underscored. If you find us on YouTube at youtube.com/youngvoicesadvocates, you'll see that we now have an Underscored interview video series. Yes. So this podcast, which we've been doing now, probably for about 6 months, sort of in this model and calling it Underscored and doing these interviews in a different way. It's really taken off. It's been a big change for the Young Voices podcast, and we wanted to add a new component to it. So I went to DC and spent some time in a studio with 5 different writers for Young Voices and sat down to talk to them about their areas of expertise. And that yielded a series of interviews with our folks on healthcare policy, immigration, school choice, the opioid crisis, and more. And today, I'm going to be sharing the first one of those episodes here on the audio form of the podcast. This is a conversation that I had with Elise Amez-Droz. She's a Young Voices contributor and writer on healthcare policy. And we went deep on issues surrounding the really broken U.S. healthcare system and some of the disconnects that we have with the rest of the world. Now, you may be thinking that this is going to be some sort of conversation pointing us towards a single payer model or sort of European style healthcare, but Elise really has a different perspective on this that I think a lot of people aren't considering when it comes to how healthcare works abroad. There actually are some good free market approaches to how this system can work better, and she's going to explain all of that right now. Elise Amez-Droz, thank you for joining me today.
Thank you for having me.
Absolutely. You've written a lot about the U.S. healthcare system, some of the just glaring flaws that exist in it. What would you like to see health insurance look like in the United States to be a more constructive model that would perhaps ease some of the angst and tensions that we have here over constantly reforming healthcare?
Yeah, no, you're right. I think there's a lot of reforms that need to happen, but the first thing is healthcare has become something other than healthcare. Insurance, I mean. So insurance is turning into something that pays for every aspect of your healthcare. So whether it's a small, visit to the office, to the doctor's office, or a big surgery, healthcare insurance comes into play and pays for all of that. And I would like to see it become more of a catastrophic insurance, where so you would pay a monthly fee just like you do right now, but instead of it coming in and paying for the small aspects of your healthcare, it would just be for the big things when you go to the hospital.
Interesting. So you're imagining a system where when you need to go get your checkup, get your physical, or maybe you have just a cough and you want to go get that checked on, that is out of pocket. That strikes me as expensive. Is there a way and sort of a market mechanism that would make that actually pretty affordable to accomplish?
That's a really good question. I think that's the main issue right now is all of healthcare is expensive, not just the big cancer therapy, but if you break even just a finger, it's going to be a very expensive hospital bill. So the first thing that needs to happen is more competition between the different providers. So when you go to a doctor, you should be able to know how much things will cost and, be able to compare different doctors and have more quality signals as well.
Yeah, I think doctors' offices are always aggravated with me because I want prices when I go in and I'm like, all right, so I'm going to do this doctor's visit, but how much is it actually going to cost? What do you think is the disconnect with our politicians in the way that they talk about healthcare versus health insurance? There's sort of that rhetorical thing that you mentioned earlier where they sort of are blurring the lines between the two. How can we sort of make that more clear in public discourse?
Yeah, that's a good question. I think it's difficult because historically it's been a while that we've had this system, and so it's difficult for now to differentiate between health insurance and healthcare. Healthcare is really what you receive as care. If you need to go to the doctor, if you need a diagnosis, if you need any kind of lab tests, all of these things are healthcare. Health insurance is just a way that that you use to pay for it, and so it's really making this distinction. I think that's important in the way we talk about healthcare to start thinking about it more rationally. And then also thinking about healthcare as just a way of taking care of our health, but it's not the only way. There's many things that we do in our everyday life that takes care of our health, and healthcare is only what you receive from a professional when you go and receive care from somebody that's been trained to take care of particular aspects of health.
You mentioned it had been this way for a while. What was healthcare like before? I don't know if you're a healthcare historian or not, but I'm curious, what was the big shift in the model and the way that we've been doing it that has sort of led us down this path?
Yeah, obviously it's a complicated story, but I know that in the 20s and 30s, there were actually models where there were facilities, entire facilities that were, had all kinds of specialty doctors. So not just your, primary care doctor, but people that had all kinds of specialties, and you would have a subscription to those. You would have insurance through them, actually. So you would receive your care from them directly, and they would be able to refer you to the right person in-house. And then that kind of went away in the 30s and 40s with, as we know, like more insurance provided by employers. And it is a complicated story, but the way it happened is those models kind of disappeared, and it became a fee-for-service kind of payment where the doctor had an incentive to provide as much care as possible, and we kind of lost this in-house, you pay directly like the doctor's like network, and there was this disconnect between the patient and the provider.
The American political right often defends the entire idea of getting your insurance through your employer as if that's ideal over, say, government healthcare, single payer. Do you view that as ideal, getting your healthcare from a place where you work temporarily?
Obviously not, right? Yeah. So health insurance is, the way it works is you need it for a long period of time because you pay every month so that if sometime you will need a big expense covered by the insurance, it's going to, help with that. And we know that employers, I know in DC, it's the average tenure time is a year, right, at an employer. So I'm from Switzerland originally, and there we actually don't have employer-sponsored insurance at all. Everyone gets their own insurance through a private market that's actually very competitive.
Interesting. So I feel like we may have a disconnect in this country about what we think about Switzerland, Nordic countries in general, and how they might do healthcare. Again, kind of going back to employer insurance, we sort of view it as sacrosanct, but it really takes away a lot of flexibility from Americans to move, be able to travel for new work, pursue new opportunities, shake things up. What could we take away from Switzerland that would make our system better? Yeah,
so definitely, like you mentioned it, like the states, state insurance here is an issue. So where you have each, the blue plans are, per state, things like that don't need to exist. It would be so much easier if you could move to California tomorrow and know that you could take your insurance with you and it would be no problem at all. And I know that that's something that we actually don't have in Switzerland. So it's a small country, so thankfully that's not the case. But still, you can just get insurance and be covered like further than your own state. So I think that would be a good thing to implement.
So by and large, Americans tend to agree with people like Bernie Sanders about single-payer health care, Medicare for all. These are things that poll very well until you ask follow-up questions, such as, what is the change in your tax going to be? Are you going to be able to keep your doctor? What about your neighbor? Are they going to be able to keep theirs? And then you see the approval really drop off. So Americans are searching for something, but they really aren't sure how to grapple with the details. What do you think Americans are lacking in their healthcare that has sort of made our political system so tense on this issue? What are they looking for?
For care to be easier, I think. It's just gotten so complex. The regulation is so overbearing for providers as well. Like we know doctors actually don't like the current system. They spend like half of their time with a patient just looking at a screen, recording information. So just make healthcare what it was supposed to be, which is this relationship between the patient and the doctor, and remove all the kinds of barriers that are not actually helping patients or not protecting them. Those are good. Those are good things to have. But we don't want it to be so heavy like currently is, where it's just impossible to navigate the system.
Elise Amez-Droz, I really appreciate you sitting down to talk with me about this.
Thank you so much for having me.
All right, and that's it. That was my conversation with Elise Amez-Droz of Young Voices on healthcare policy. You can find Elise on Twitter at Elise Amez, so that's AMEZDROZ. Elise Amez-Droz, and myself on Twitter at Stephen_Kent89, and of course Young Voices at YVADV. I really hope you enjoyed this version of the show that we're going to be having more of over the coming weeks with other Young Voices writers on a variety of topics. And again, you can find the video for this interview. Beautifully done. I'm personally really proud of it, so you should check it out at Young Voices Advocates on YouTube. That's youtube.com/Young Voices Advocates. Maybe throw a subscribe our way too, and then you can catch more of our videos and folks doing TV and radio interviews when those hit the web. All right, that's it for Underscored. We'll be back next week with more, and we will be featuring Jacob Rich of Young Voices with his perspectives and solutions to the opioid crisis. Until then, stay free.